So the iCam came second. PIC is the OG, right?
Yep, PIC is the OG system.
Got it. And then like there's some players that are trying to get in as well, right? Yeah. So I think Shining 3D is Chinese, and their sales reps are amazing. I know Troy's always been good to me, so I'm excited about learning that one. It seems like their scan flags are a lot smaller than the PIC ones, right?
Yeah, they're just different. They're horizontal scan bodies versus PIC. It looks like a little flag. It looks it's a flag with some dots on it.
It's probably designed to pick up from extraoral, right?
It is an extraoral, yeah. So, and the nice thing about PIC too is people actually complain about how big the flags are, but it makes it easier to see them when scanning. Mm-hmm. And they listen to their customers, and they came out with a mini flag so that you could place mini flags in the anterior region and bigger flags in the posterior. So it's a lot easier to scan now. Cases I've not had any issues with scanning them.
So how do you take the facial scan and transfer that to like the vertical? How do you figure out the vertical? Do you have the face in the lab, basically?
Yeah, so we use exocad to design all our full arch cases. Right. So we take that facial scan, and you have a picture where it's retracted too in the facial scan, and we use points on the tissue to align it with the tissue scan, to align it with the just separate STL that we have of the upper, lower, and bite. Okay. So that's how we're able to bring it into the face.
Okay, gotcha. So it's just kind of, it's almost like an all-in-one thing, right? I mean, you don't need anything else. You've got the PIC scanner, and you've got everything you need from that scan, to the implant position and the face. You need to establish a vertical though, right? Right.
So the PIC, and just like any other photogrammetry system, gets you just your implant positioning, gets you your angulation and your distance between the implants, and then that's where you have an intraoral scanner to get your video and your tissue scans, and then you merge all of them together. And then you have your, of course, Instarisa or your facial scanner, whichever one you're using.
Mm-hmm. Got it. Okay, so you got your PIC facial scan, and then you need an intraoral scanner STL file, right? And you merge it. So the intraoral scan, is that where you like to use the scan bodies and that you showed me?
So intraoral scan, that's where there's a couple different ways to get record with your intraoral scanner. And of course, you can do this with any intraoral scanner. I've personally worked most with Trios and iTero. They seem to be, and Shining 3D is what I've recently been working with a lot. Mm-hmm. Those are all great systems, especially for day of surgery. They pick up blood very well, or bloody environments. Yeah. So what I would do for the tissue scan is I pick a library that's also built into my photogrammetry system. So whatever healing cap I use, I convert my photogrammetry STL to that same healing cap. Mm-hmm. I'll place those healing caps and I'll scan the tissue, and then I use the healing cap geometry to merge the two together. And then you have your verified model. Okay. And then that's where it gets tricky with video. If you're doing it this day of surgery and the patient has teeth, the most accurate way to do it is to place fiduciary markers, which are bone tracers. On an upper, we'd place 2 in the palate. On the lower, we recommend doing 2 in the retromolar and 1 in the anterior region. Mm-hmm. So you'd place those and then scan with those in place before you do any extractions. Go ahead and do your surgery, and then when you go to that tissue scan with your healing caps, you also have those fiduciaries in place, and you just merge those two together.
It's kind of like breadcrumbs, that's how you find your way back, right?
Right, exactly. Because when you do surgery, your tissue gets so inflamed, you've flapped, you lose your markers. Nothing looks the same.
Right, it's the one thing that stays the same.
Yes, exactly.
Good. And so I'm thinking maybe just the Lumina scanner and then the PIC scanner would be a combo that would be all you would need.
Yeah, any photogrammetry scanner and an intraoral scanner. And that's the cool thing about Shining 3D is it's all one.
Yeah. Or something like that, right?
Yeah.
And I'm just curious if the price will come down and if more dentists will be able to, to be getting involved in this.
So the price is already coming down. I know that. When we bought our PIC system, we paid $57,000 for it. Now I believe it's somewhere around 40,000 because it is pretty competitive with iCam, which is $40,000. I know that Micron Mapper and Shining 3D are both less than that. So it's a competitive market right now for those companies.
Yeah, it sounds like it's going to be, even more so. And, I'm fascinated with how it's, what's going to be, the leading system in the next 5 years or 10 years.
Yeah, me too. I like to just play around with all of them since we have so many in our offices. I like to just scan with all of them and then compare the data and see which ones. It's hard to measure passivity and accuracy. So I haven't figured out the best way to do that. I compare them to each other, but how do you know which one's most accurate? That's where I'm having difficulty comparing it.
Right. I mean, one simple way to do it is basically do split testing, right? You'd have to do 2 frameworks twice,
right.
2 of them, and try them. One of the things that is going to be really appealing to the general dentist is the software, and I think that the hardware seems to be already there. Lumina 6 cameras. There's a lot. Intraoral scanners are becoming faster, and that's not the limiting factor anymore. They're all becoming so good. Now it's kind of there's going to be a fight for which one has the smoothest software, and which cloud is going to be easier to operate, stuff like that.
Definitely, yeah. And the fun part about intraoral scanning too, especially when you're learning on so many systems, is each scanner has its own strategy and scan protocol, and you have to learn every single protocol.
You're right.
Because if you don't follow it, you might end up with an STL that gives you the information you need, but how accurate is it actually?
And you won't know.
Yeah, exactly.
You'll never know. The scan path, right?
Right.
That's recommended.
Yep.
Yeah, I remember learning about, scan path when we were scanning for ortho, and in CEREC. That was really important.
It is.
And then did you see any differences with the Shining 3D today?
With the scan path?
Yeah.
I did not. It's from what I understood, it's pretty occlusal lingual buccal, just like most scanners. I would have to look into it. I mean, it varies if you're doing a dentulous scan versus just like a study model scan. And that's true for every scanner. The scan path is going to be different.
Yeah.
So I didn't get to play with it much in different, because we just had that one patient. So.
Yeah, I even had my brand new assistant. She's wonderful, and
yes.
She was able to do it pretty well.
Oh, she did an amazing job.
Yeah, and with Troy there, able to cut tissue when necessary was super great. So this is a really exciting chapter in my life. I'm really happy that you came.
Thank you for letting me be a part of it.
You're welcome.